Now, it affects nearly 7 million children in the U.S. and accounts for more hospitalizations than any other childhood disease. While there is no cure for asthma, there are new ways it's being treated. Here to explain is Dr. Roger Friedman, an allergist with Ohio ENT and Allergy Physicians. Dr. Friedman.
Good morning.
Good morning. Always a pleasure to have you with us.
Thank you, Crystal.
Okay, so first of all, doctors are classifying asthma differently, and this is changing treatments.
It is. It is. What we're trying to do is better define what type of asthma a person has, and by knowing what we call the phenotype or what we call the endotype, and those are different words of way we describe asthma, we can have different responses to therapies. In the past, like all medicine, we try medications and see how a patient will do. If we have a better idea what type of asthma a person has, we know better which medicines will work best for them.
And this is leading to new medication combinations, right?
New medication combinations and new use of sometimes older medicines, medicines that we used before for chronic obstructive pulmonary disease, things like emphysema, is now can be used for certain asthmatics. Exciting time.
So what are you seeing as a result?
We're seeing better response to therapy. We're seeing less failure in therapy, and we're finally being able to get a handle on things where we can decrease hospitalizations, decrease emergency room visits, decrease children's morbidity from asthma. In other words, so they can go to school, play sports, and be as active as anyone else.
It's pretty shocking. Asthma is the #1 cause of hospitalizations in children.
It is, and it has been for over 30 years. And what our goal and really what we're trying to do is trying to decrease that tremendously and make it so that so many of our kids don't end up in the hospital anymore. And we've taken a big step forward in that.
And there's a connection between asthma and allergies. Well, how does this affect?
Allergies are the #1 trigger for asthma, and they're the main factor that leads to children developing asthma. Okay. An example being if you are highly allergic to dust mites or cockroaches or cats, having those in your house will cause major problems. Sure. On the other hand, if you're not allergic to those things, actually some of the exposure, say, to cats early in life may prevent you from developing asthma. So it's important to know, are you allergic? And if so, how to avoid those things.
I understand there's a new biological therapy for one particular form of asthma. What's this?
There is. There's a new medication called mepolizumab.
Okay.
And biologic is it's a monoclonal antibody. And so it's a injectable therapy that can knock out what we call eosinophils. Eosinophils are one of the major cells that cause asthma, cause a lot of the harmful chemicals that cause asthma. And this is truly revolutionary for those people who have a high eosinophil count and severe asthma.
So what should parents watching right now, what should they know if they have a child who has asthma or if they suspect they do?
So if they suspect or they have a child who has asthma, their primary care doctors, their pediatricians, family doctors, older kids, maybe internists, manage lots of asthma and do a very good job of it. We have lots of medications that work excellent for our patients. But if they're having more problems, that's when it's worth seeing an asthma specialist, typically an allergist or a pulmonologist, to evaluate the child to see whether they have trigger factors, especially things like allergies that can cause them to have increasing asthma problems. If we find out that you're allergic to things, then we can avoid them, or we can even use allergy shots or immunotherapy. In addition, many of our patients may have comorbid conditions. Comorbid conditions being things like sinusitis, things like gastroesophageal reflux. And many of our patients can have what we call vocal cord dysfunction. And those are all diseases that can be helpfully diagnosed not only with the allergist, but actually with the ear, nose, and throat physicians. And that's some of our collaboration with our ENT colleagues, trying to figure out which patients need to see the allergist and ENT physicians to make the diagnosis.
Ohio ENT and Allergy Physicians is a good place for parents to start.
That's a real good place to start, and a real good place where we can work on collaborating and making, again, emphasis on trying to treat the disease and making a child not have the problem.
Very good. Dr. Friedman, thank you so much.
Thank you so much.